What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video we're covering how often do you have to wait on other medical workers such as nurses, phlebotomists, doctors, anyone else, residents. So you can go perform your exams of the beautiful X-rays to save people's lives because they can't breathe mainly or chest pain. But anyways, so to give you context, I am an X-ray tech, been doing it for 4 years, work night shift, day shift, do it all, a lot of overtime. So, I would say there's a little bit different dynamic versus days and nights, slash if you're in the emergency room, slash if you're on the floor. Each one will come with their own dynamics. I will say during daytime, you will have to wait significantly longer unless you have a very close relationship, especially in the ER, with the nurse. Most of the time, they're going to tell you, nah. Or they're going to be like, as soon as you knock, they're like, patient care, or the nurses are in here. So most likely you're going to wait significantly. Versus daytime, depending on what's going on, unless they're like mid-blood cultures, mid-stick, mid-actively doing something, they'll kind of, especially if it's just a chest X-ray, majority of the times they'll let you just come in, shoot your picture, and then go on about your business, which is, always nice. Because, especially if it's just a one-view X-ray, 30 seconds, in and out. You won't bother them ever again. So most of them, unless they're new, they'll just kind of let you do it, especially in the trauma room. They'll, in and out. I will say on the floor, I've noticed most nurses, because I guess they have more patients going on, unless they're doing like patient care, they'll kind of like let you shoot it, and then because they'll like go and there's like someone else they'll go and do. Most of the time on the floor, the people you'll kind of wait on are the doctors, of course, because, they're important. They're explaining to the patient what's going on, any updates, and, other stuff like that. Residents tend to take a little bit more longer than the actual regular doctors who are on the floor. That's what I've tended to notice. Same thing with, in the emergency room. The residents take a little bit more longer versus the actual ER doctors who hold down the emergency room. They're in and out, getting straight business, especially if they see you there. They'll be talking to the patient or getting information from the patient as you're setting up, getting stuff, because they want to, hurry up, every second counts type stuff, especially if they're really bad. So that's a situation you can find yourself in. I will say for the night shift on the floor, it's kind of different, because usually when we go on the floor, especially if it's morning ports, it will kind of vary. Certain floors, no, like ICU, surgical ICU. Certain floors are more they kind of work with us because they kind of have to know what, they'll look at the X-ray and kind of know, okay, we're going to do this, we're going to do that for our patients, because they're more critical. Because if they see a pneumothorax or anything, that will change their patient care, how they're treating the patients, completely different. So most of the time they'll let us kind of do our stuff, because most of the time we really don't. We just do a chest X-ray or do an NG tube, majority of the time that's all we do on those floors. So they'll kind of let us do our own thing. Phlebotomist, during, I believe at 5 a.m. they start making their rounds. So phlebotomist is kind of different. If they're actually mid-stick or it's a hard stick, they'll kind of look at you and be like, hey, I would let you, but I'm already sticked in there. Or, hey, can you go somewhere else? Do other ones around the floor. Usually that's how it goes. So it all varies. I will say, once again, since I do both teams, days and nights, significantly more people, even to get to the elevators. That's another thing. The elevators, that right there, especially between 11 to 1, or the lunch rush to get to the cafeteria, that if there's a code, you might as well just wait, because the patient's not going to get their X-ray, because you're going to be waiting a long time for the elevators. And then us as the X-ray department, we have the portable machine. We can't take the stairs, so that's another thing that outside of workers you'll have to deal with. So yeah, it's been your boy Miguel. See you on the next one.